Thank you all for joining me today for our info session for our doctoral student grants. We will be going over a general overview of mental health first aid, as well as the current state of mental health first aid research in the US, and then I'll do a deep dive of our application process and timeline, and then we'll have some time at the end for next steps and any questions that anyone may have. So our team at the National Council is small but mighty. We're led by our director, Dr. Lacey Rosenbaum. And then I am Sanjana Bhakta. I am our manager of curricular research and evaluation for mental health first aid at the National Council. I lead and manage a lot of most of our research and evaluation initiatives, including our grants program, our mental health first aid research advisors, as well as the development of our evaluation tools and any research initiatives. So I believe most of you are already familiar with mental health first aid, but if you are not, I just wanted to go over briefly the history of our program, as well as some of the research that's been done. So mental health first aid originated in Australia. It was created in 2001 by Anthony Jorm and Betty Kitchener. The vision behind mental health first aid was really to create a first aid program similar to CPR, but that was focusing more on mental health rather than physical health. So that was their vision behind the program when they created it. And since then, it's been expanded and adopted by more than 27 countries across the globe, including a lot of countries in Asia, Europe, and then the United States. So the National Council for Mental Wellbeing, we were formerly known as the National Council for Behavioral Health, brought the program over in 2008. So Mental Health First Aid USA has 4 core curricula. Our best known programs are adult and youth programs. Our adult program is for community adults, and it has modules that are specific for different audiences. So the modules are really meant to be supplemented with the core curriculum. So we have currently the public safety module, we have a fire EMS module, a higher education module, as well as a veterans and military module. And these modules all contain specific statistics for that population, specific scenarios for that population. It's really meant to give more of a catered delivery of the program for those audiences. And currently we have an in-person, a blended, and a virtual format for the course. So the in-person is going to be completely face-to-face with 1 or 2 instructors. The blended version contains a 2-hour self-paced course online, followed by an in-person segment with instructors, and then the virtual is completely online. Then we have our youth mental health first aid program, which is for community adults working with youth. So it's not for youth themselves, but for individuals working with youth. Want to make that, there's a bit of a confusion with that, so just want to make sure that I address that. So like the adult course, we also have in-person, blended, and virtual. And then one of our newest programs is actually our teen mental health first aid program. We brought that over a few years ago and have been piloting the program in high schools across the US in collaboration with our colleagues at the Johns Hopkins Bloomberg School of Public Health. So we are kind of wrapping up the piloting phase for that program, and are working on a national launch for towards the end of this year. So more to come on that, but that program is a peer-to-peer program. It's meant for high school students between the grades of 10 to 12. We currently have an in-person version, which we've been piloting with, and we are working on a blended and virtual version for the future. And then our smallest but mightiest program is our corporate mental health first aid at work program. This is meant really for for-profit institutions. It's the content is more geared towards mental health in the workplace. We have it available in person as well as a virtual one in the pipeline. So since we brought over the mental health first aid course in 2008, we have updated it. We recently released our mental health first aid 2.0 update last year, and this update really focused on expanding content in areas that were relevant to the mental health of the US. So we really added a lot of content on trauma, wellness, resilience, self-care, and cultural considerations. And since we did update the curricula, we are working currently to update the modules for the adult course to align with the mental health first aid 2.0 curriculum. So those will be coming out relatively soon as well. So we are here today because mental health first aid is really interested in expanding our research and evaluation work across the US. We are very interested in modeling our research arm from the Mental Health First Aid Australia research arm. Mental Health First Aid Australia does a lot of research at various stages of the development of their course. They conduct research during the development phase, during the delivery phase, and then also after in the update phase. So that is really what we're looking to model our research arm off of. So I really wanted to highlight one of the processes that Mental Health First Aid Australia uses in the development of their curricula, which we have been using, and most recently we used in our teen course. And this is the Delphi Expert Consensus Method. So this is what we did for our teen program. We started with framing a research question, which would be the mental health of teens and what is the most relevant content for that population. And then we convened a panel of stakeholders. So we convened teens, we convened individuals that work with teens, SMEs who specifically study the mental health of teens. And then we displayed, or we showed them some content, and we gave them a questionnaire to for them to really give us feedback on the content, if it was relevant, if it was appropriate, and what pieces of content, if any, should be taken out or improved upon. And then based on those results, that's how we developed the teen program, and that's how we adapted it for the US. And this is really the foundational processes that Australia uses to develop their course. And because of their very rigorous research processes, they've really been able to grow into the 27 countries that I mentioned. And the University of Melbourne actually has a strong relationship with Mental Health First Aid Australia, and that's how they do a lot of their research. And studies from Australia have consistently shown participants who complete the Mental Health First Aid course have improved knowledge of mental illness. They have improved knowledge of appropriate first aid strategies and confidence in providing aid. And other studies have also shown improved mental health in participants themselves, decreases in stigmatizing attitudes, as well as increases in the amount of support that is provided to others. So now we're at the current state of the research in the US. So the good news is that there are researchers and organizations that are independently conducting evaluations on mental health first aid in their communities. Previous studies have shown very similar outcomes to those that have been conducted in Australia in terms of improvements in mental health literacy, decreases in stigma, increased willingness to assist a person in need. And this is really what we're trying to build upon here. We have the foundation down, but we really would like to streamline these processes and empower other researchers to continue conducting evaluations on our program. So with the Mental Health First Aid 2.0 update, we also updated our evaluation strategy and our tools. So our new curriculum actually uses Kirkpatrick's 4 levels of evaluation to measure the impact of the program. So In these evaluation tools, we measure reaction. So we measure satisfaction with the course with the instructor, which is pretty standard. This data then feeds into our internal quality assurance process. And then the evaluations also measure learning. So there's a subset of questions that are really geared towards understanding the knowledge transfer from the course and if learning objectives are met. And then the areas of opportunity that we see really are in the behavior and learning, or behavior and results, excuse me, areas. So we're really interested in knowing more about the ROI for the mental health first aid training, the impact on mental health outcomes in communities with high penetration of the program, the impact on treatment, seeking treatment, referrals, and the experience of individuals who are assisted by a first aider. And although our evaluation tools do attempt to measure this information, we really would like to explore this further and to add a little bit more rigor to our impact evaluations. And that was the vision behind the creation of our doctoral grants. We really want to empower young researchers to look at the impact of our program in communities that they're interested in, and help us really make improvements to the program itself. So the grant itself, this is our first year, our first round of these grants. And the grants will provide a one-time award of $5,000 to 4 doctoral candidates who are interested in evaluating the outcomes of our adult or youth mental health first aid training in the US. So in terms of eligibility, we are looking for full-time students pursuing a degree in psychology, public health, education, or really any related field. And we would prefer that they have previous evaluation experience, a demonstrability document, findings through publications and or presentations, and experience with mental health first aid itself, as an instructor, as a coordinator, even as a first aider. Some exposure to the program I think would be beneficial in terms of applying. And here at the National Council, we do value DEI. So we are very interested in candidates who are bringing that DEI lens to their work, and or exploring a population with mental health first aid that hasn't really been studied, and or are interested in recommending ways based on their project to make the curriculum more culturally relevant for a specific group of people. So the requirements, if you are a grant recipient, you will be required to submit regular research updates to our mental health first aid team. And that is primarily myself, as I'll be managing the program. So you'll see my face a lot, and I'm always here to support you along the process. You will also be required to participate in quarterly research calls with the other grantees. And this is really just to provide additional time for you to interface with myself, ask questions, and also for you to interact with other grantees, share lessons learned, challenges, and kind of work through anything you might be experiencing in terms of implementing your project or evaluating your project, or whatever phase you may be along the way. Really just meant to be as like a support group. And then as a grant recipient, after the 2 years are complete, you will be required to submit a final report of your research findings, as well as present at a mental health first aid sponsored event such as NACCON or Instructor Summit. Really any professional organization that you feel is relevant for your project. And more details on that obviously coming further or later. If you are a grant recipient, you'll receive more details on what exactly the report should look like, what presentation should look like, et cetera, et cetera. So I will pause there. I will be going through the application process and the timeline, but I just want to pause to see if there are any questions that I can answer thus far. If not, we will still have time for questions at the end. No.
Hi, can you hear me okay?
Yes. Hi, Melanie.
Hello. So my question is about presenting.
Mm-hmm.
It says at a mental health first aid sponsored event. So that $5,000 doesn't go towards that, right? We would be responsible for getting to the event?
Let me circle back on that. I don't believe, I believe we would cover that cost for you. Because we'll probably be back in person by the time you would be doing your presentation. So my hunch is that we will be covering that, but I can circle back on that. And then I see Kate has a question. What are acceptable and unacceptable things to spend grant money on? Great question. So we would consider anything related to the actual implementation of your project to be acceptable, right? So funds to cover the cost of the training, funds to, if you are not an instructor yourself and you're, working with an instructor, perhaps providing them a stipend, the cost of manuals, perhaps. So those are the types of things that we would deem as acceptable. Now, as we do review applications, if we see something that we feel would not be acceptable, we would reach out to you. We would probably have that discussion. We wouldn't want to just dismiss your application because of one or two things we may not feel that the grant money can be used for. So we would work with you for that. Yes, a DSW program does count. Any doctoral program counts. And then can I submit the grant application as a student, or does the grant need to be submitted by my university? Great question. So the grant application should be submitted by you as the student. Your university does not need to submit it on your behalf. We do ask what program you're in, who your advisor in as a part of the application. And if you are, if you do become a recipient, we will ask for verification, but you will be submitting it as the student yourself. The RFP is pretty, oh,
Excuse me.
yeah.
I wanted to ask, if the person is not a full-time doctoral student, how does that impact the application?
Great question. So when we initially sought out this process, we were focused on full-time, but if an individual is part-time, we will accept that. We will probably, what we would do is we would work with you or work with the student to extend that timeline. Because if you are part-time, 2 years is not very feasible to complete your entire project. So if you are part-time, we do encourage you to still apply. The timeline would probably just be a little bit adjusted for you. If you do fall into this category, please reach out to me and we can have a more detailed conversation about what that might look like.
And then just to ask, if you're trying to do the program and then would that cover the cost of trying to grant, like, how do you say, train somebody to become a mental health first aid trainer, something like that?
You could use part of your funds to become a trainer. Personally, what I would recommend is that you connect with an existing instructor, and that's something I can help you with. Depending on where you are, so let's say like I'm DC based, if you're in DC, I can provide you with a set of instructors in good standing, and you can work with them to implement your program.
No, no,
So
no.
that would be my
I,
recommendation. But you can, if you would like to become an instructor yourself, you can use part of your funds to do that.
no, I'm already an instructor. What I'm just asking is if I am targeting to provide that resource for someone who wants to become an instructor, would that be a an allowable way of spending the grant?
I would think so. If that person will be supporting your project, I think that is justifiable. Yeah.
Okay.
Mm-hmm. And then let me see here. Kate has another question. The RFP is pretty specific to quantitative research method analyses. Can we do a rigorous? Yes, you can do a qualitative study. Sorry about that. Qualitative or quantitative, either is fine. Mixed methods is fine. We just want to see your strategy, your techniques. And what value that would bring to the impact evaluation. So yes, quantitative, qualitative, either is fine. Great questions. Awesome. So we will have more time for questions at the end. I do want to go through some of the details on this application process. So I will go ahead and get started on that, and then we'll come back and address any more questions that you all have. So as many of you I think know, the application is already open. It actually opened last Friday. I've seen quite a few of your names in there already, so that's great to see your faces here. So the application is available on our Mental Health First Aid Award Force portal. This is where it's housed online. The URL is on the screen right here. It is also available on our Mental Health First Aid website. And if you don't have the link, I will be sending out this PowerPoint at the end so that you have access to that. So when you do go into the application, you will be prompted to register. So on the left-hand side, you'll see you'll need to provide your first name, last name, email, and then just set a password. For the email, please use something that you check on a regular basis. This is the email I will use to communicate with you in terms of the process. So like when the review has started, if you are offered an interview, that's how we'll communicate with you. Just please make sure you use an email that you check. And then anytime you return to your application, you'll simply just need to log in. You don't need to re-register every time. Okay. So when you register and get into the application, you can't see the screenshot here, but you'll actually land on the Start Here tab. And in that tab, the doctoral grant for mental health first aid will be pre-selected for you. And then you'll have an option to enter like an entry name. There you can just put your name or the title of your project, either is fine. We'll capture that information later as well. And then you'll be prompted to go to the Your Information tab. So this is where we're going to collect all the information in terms of contact, your degree program, what year you're in, who your advisor is, what your interests are, all of that good stuff. And then again, please make sure you include contact information that you check regularly so that I can communicate with you. And then we have the project overview tab. So this is really just to get a general overview of your project. You don't need to be very detailed here. We're really just looking for a topic, why you're interested in researching mental health first aid, and where you're planning on doing your project. And then we have the project detail section. So this, sorry about that. The project detail section is where you're going to be providing all of the details on your project. So this is where you want to be very specific about your background, your significance, your aims, your qualitative or quantitative analysis techniques, and then your dissemination techniques. This is where you want to put all that information. What I do recommend is that you complete everything on a Word document. That way you don't lose any of your progress if you're typing into the online portal itself. And so what I recommend is you just complete everything on Word doc, and then you can just transfer it over onto the online portal. What you can do is that you'll see in a little bit, there is an attachment section. You can submit the full document version in that attachment section as well. We do want it like in this tab, but you can submit the full doc since you worked on it as well. And then just a quick note about, we'll ask you for like a protocol and methodology. You may use our existing pre and post evaluations for our adult and youth courses. If you are not already an instructor or haven't seen them, reach out to me and I can share those with you. Obviously, depending on your study aims, it may not make sense for you to use those tools, but just know that they are there if you do want to use them. Wonderful. And then we have a timeline section. Just remember that the timeline is 2 years for the grant, so make sure that your timeline reflects that. Now, if you are a part-time student, we can discuss that offline. That timeline will look a little bit different for you. And then this is something that can be attached under the attachments tab as well. Same with the budget. The budget amount is, or the grant amount is $5,000. So just make sure your total budget reflects that. Now, if you do have any sort of other funding you're going to be using in conjunction with this, you can put that on there. Just make sure it's reflected so we know where it's coming from. And then this also can be attached under the attachments tab. We do recommend an Excel format for the budget itself. You can do it in the doc format if you'd like to, but Excel is generally a little bit easier to kind of follow. So if you can, that would be the preferred way of submission. And then this is just a screenshot of the attachments tab. So as you can see, you can put your timeline here, your budget, and you can add any other attachments you want. So let's say you are going to be using different tools, you can attach them here. If you worked in a Word document, you want to attach that here, you can do that as well. I believe the max is 3 documents, so just be sure to be mindful of that. Wonderful. So that is the entire application as you'll see it online. And then I just want to share some important dates with everyone. So as I mentioned, the application has already been released. It is on, the link is on our website. And I can also share it with you if you don't have it. Today is our informational webinar, which you all are a part of. And then our grant deadline is June 18th. So please be sure to submit your application by then. When you do submit, you will get a confirmation email. If you don't get one, please reach out to me. I can verify on my end if we see it or not. But you should get an email from the system. After the deadline has passed, we will go through all of your applications and review them. We have a selection committee, which includes myself, members of our mental health first aid research advisory group, which are academics from different institutions across the US. We have more information about them on our website if you're interested, but it'll include a few of those individuals, as well as some of our leadership for mental health first aid. And then after review, we'll select a couple finalists, and those finalists will be interviewed with our selection committee. This is meant to be more of an informal interview. We just want to talk a little bit more about your project in detail, as well as perhaps ask any questions that might have come up during the review process. So that would be perhaps when, you know, question about budget items might come up, or specific evaluation techniques or analysis techniques. Really just looking to have a conversation about any understood items. And then after those interviews, we'll have a week where we're going through and reviewing the applications and the interviews. And then we're planning on announcing our awardees in mid-July. And if you have any questions along the process, I will be your main point of contact. My email is listed here. It is also listed on the application itself, so no need to quickly scribble it down. As you go through, you'll see it almost on every tab. Wanted to make sure it's front and center just in case any questions do come up. So happy to answer anything that comes up along the way, or if you have any troubles with the application itself, please feel free to reach out to me. I know a couple of you have already emailed me, so I will get back to you at some point today with your questions. But for now, I mean, that's all I have. So if you have any other questions, happy to answer them on the call. Let me just click in the chat here. Thank you, Kate, for the Word document. It'll be very helpful for everyone.
Arish, may I help you?
What's happening to your phone now?
I don't know. It's still giving me it's still giving a little problem.
Okay. Any questions? Anything I can clarify?
I have a question. It's Kate again. Sorry, I didn't mean to interrupt you. So I'm wondering if do we have the ability, so I'm a mental health first aid instructor too. Do we have the ability to access any like large data sets that might have like zip code information? So I'm from rural Minnesota, which is why I met you in the chat.
Yeah.
I'm interested in sort of the rural application among communities of color.
Okay.
If that sort of delineated, de-identified information, would that be available from the National Council?
Yeah. Well, first, I will say I appreciated the You Betcha. I am a fellow Minnesotan. But yes, if you are interested in using existing mental health first aid data as a part of like your significance section, go onto the website and fill out a data request form and submit that. And I be sure to mention it's for the doctoral grant application, and I can help escalate that along the process because I know it'll take some time to kind of analyze that and put that in your proposal itself. So yes, feel free to reach out with that data request form, and you can use existing data for that. Yes, absolutely.
A quick question, and I'm sorry if you mentioned this already, but is there a word limit for, you know, the grant application, like, you know, the study aims and all of that, or is it open? Okay.
Nope, no word limit.
Thank you.
Anyone else have any questions that I can answer? Wonderful. Well, if anything does come up as you're completing the application or as you're working through, feel free to email me and reach out to me. I'm happy to answer any questions that you all have about the application itself. So feel free to reach out. And if not, I think we're good to go. I'll send out these slides after our call here, which will include, again, the information, my contact information, as well as a link to the actual application if you don't have it already. So yeah, awesome. Well, have a great rest of your day, everyone. Thank you for joining us today, and excited to see all of your applications come in.